Okay, so how common is axial spondyloarthritis? So we know it affects roughly 1 in 200 adults in the UK, and that's more than the individuals with Parkinson's disease and multiple sclerosis combined. And generally the public know much more about those two conditions than they do about axial spondyloarthritis. So it's not really uncommon, but similarly it's not a really common condition, and that's sometimes why there can be this issue with delayed diagnosis. So what type of symptoms will patients with axial spondyloarthritis experience? So back pain and stiffness is a really common symptom, and I'm sure it's something that everybody listening to this will experience at points, maybe constantly. And stiffness is something that we really look out for in clinic because that's something that differentiates it from the more common sort of mechanical type of back pain. Sleep disturbance is another really common feature, and classically patients will be disturbed in the second half of the night. So in the early hours of the morning, they're disturbed when trying to turn with back pain, and also first thing in the morning, that stiffness can really be an issue, which means that individuals find it hard to like have a lie in or rest in bed. They want to get up and get moving. So that leads on to the next point, is pain that improves with activity. So moving around will generally make people feel a bit better. So again, that first thing in the morning, you want to get out of bed, you want to get moving. You might have found doing some stretching helps, because again, that activity will just help to ease the symptoms. And long periods of rest will often increase symptoms. So say if you're going on a long car journey or going to the cinema or a restaurant where you're sitting still for a prolonged period of time, often your back can feel a bit uncomfortable. It will increase your symptoms, and again, moving around a bit will again help to ease them off. Fatigue is something that patients often experience, and that's probably for a number of reasons. It's tiring living with pain, often sleep's disturbed, and also as part of an autoimmune inflammatory condition, fatigue can be something that patients experience. So again, something to bring up in clinic, and again, there's strategies that we'll talk about later on in the presentation to help manage some of these symptoms. Peripheral joint symptoms. So patients with axial spondyloarthritis, obviously the spinal symptoms, hence axial, but some patients will also experience peripheral joint symptoms. So that might be the knees, ankles, wrists. They can also be part of the presentation. Dactylitis is a word which means swollen digit. So fingers and toe swelling this relates to. So it's not a little bit of puffiness, it's like a sausage. So your finger will look like a big fat sausage, or your toe, and that's dactylitis. Again, not everyone will experience that, but some patients will. Enthesitis is where the inflammation is present where a tendon is attaching to the bone. So quite commonly that can affect the Achilles tendon. And again, something that we might see on MRI scan or an ultrasound. So again, Achilles tendon pains can be part of the presentation. And also we know that uveitis, which is an inflammatory eye condition, inflammatory bowel disease such as Crohn's or colitis, and psoriasis, which is a skin condition, these three conditions are linked to axial spondyloarthritis. So again, something that we will regularly ask you about in clinic, just to see if you have in the past experienced those symptoms or going forwards experienced any of these symptoms. So it's important for you to know about those and understand what they are, so that if you do experience any abdominal or skin or eye issues, that you discuss them to find out what exactly it is and get the most appropriate treatment. And the other thing is that mental health issues are being acknowledged more in patients with axial spondyloarthritis. Obviously, I'm sure many of you have experienced a delay to diagnosis, and that's something that our team and NAS, the National Axial Spondyloarthritis Society, is really focused on reducing that delay to diagnosis, because it can be a really difficult journey. Quite often you're seeing lots of healthcare professionals, and the correct diagnosis hasn't actually been made. Visiting lots of healthcare professionals, spending lots of money on it, trying to live with the condition at a time when you're trying to work, have relationships, family, you're not sleeping well. So there's a real awareness of the mental health burden of managing a long-term condition, but also often the journey that patients have to go on in order to get the diagnosis. So again, something we're more aware of, and we've got a resource for you later in the presentation to help with that. And next slide. So what treatments are available? And we're going to talk about each of these in a bit more detail, but exercise and physiotherapy is something that is really, really important and sort of non-negotiable, really, not necessarily the physiotherapy part, but exercise, you know, is something that we're keen for you to all be able to establish in your week. And if physiotherapy is required to help you manage that, then that's something that we can refer you on for. Medication is also important, which we're going to talk about in more detail. And again, mental health awareness, we've got a link for a video that we'll show you later on in the presentation, and also wellbeing strategies. So sort of other things that can help you to feel a bit better in yourself in general, which can then have a positive impact on your condition. So I'm passing over to Naheed.